So today we will discuss about the hyperuricemia and gout. So catabolism of purines like adenine and guanine, they produce uric acid. And at physiological pH, the uric acid is mostly ionized and is present in the plasma as sodium urate. And elevated serum urate concentration is known as hyperuricemia. So this is the definition of hyperuricemia. So there can be various causes of hyperuricemia. It can be due to the increased uric acid formation or due to the decreased uric acid excretion, either excessive formation or decreased excretion. So if there is a lack of equilibrium in between these two phases, so there will be hyperuricemia. So the average normal blood serum level of uric acid is 4 to 7 milligrams per 100 ml. And the majority of uric acid is excreted via the kidneys in this concentration. This upper normal range is 7 milligrams per 100 ml, which is above the solubility of sodium urate in water. So, which is 6.4 milligrams per 100 ml. So, the elevated level of this uric acid, that is hyperuricemia. So what can be the causes of this hyperuricemia? They can be primary causes or the secondary causes. So primary causes can be due to the enzymatic defect. We have seen in the purine de novo synthesis. These are the three important enzymes in the pathway. They are PRPP synthetase, PRPP aminotransferase, and HGPRTase. This is the enzyme of salvage pathway. And these enzymes are well regulated by product inhibition through feedback, negative feedback regulation. So if there is a defect in these enzymes, so there is a loss of regulation, feedback regulation, and there is an excessive synthesis of the uric acid. So this is the primary cause. Secondary can be due to the increased dietary intake of the food products containing a lot of nucleic acid products. Then you have nucleic acid turnover, then ATP breakdown, deficiency of glucose 6-phosphatase. This enzyme is the enzyme of the glycogen metabolism, and due to the deficiency of this enzyme, there is a no accumulation of glycogen. Glycogen is not converted up into the glucose. So there is a accumulation and fatty liver disease is there, and this condition is Von Gehrig's disease. So the patient now glucose 6-phosphate, and there's a lot of accumulation of this glucose 6-phosphate, and it is diverted to the synthesis of ribose 5-phosphate via the HMP shunt. So this is how this can come in the secondary cause. Then due to the defect in uric acid excretion, so what can be the causes? The primary can be the idiopathic with the unknown reason. The secondary causes can be due to the renal inefficiency, then metabolic acidosis, then lactic acidosis, ketoacidosis. All these acidotic conditions, they they decrease the pH and thereby increase the concentration, increase the precipitation of uric acid in the form of, and their deposition in the form of crystals and further formation of stones. Then starvation is a condition, diabetes mellitus, increased tubular reabsorption. So all these conditions are the secondary causes for increased concentration of uric acid in the blood. So not all hyperuricemia can cause the gout. Gout is a clinical syndrome associated with hyperuricemia and recurrent acute arthritis. So in the gout, it is a metabolic disorder associated with an elevated level of uric acid concentration in the blood or serum. The increased serum uric acid is due to the either increased formation of uric acid or its decreased excretion. Then whatever be the cause, the gout is associated with hyperuricemia, but hyperuricemia is not always associated with gout. So what is primary gout and what is the secondary gout? So primary gout is generally due to the metabolic defect, enzymatic defect. It is an inborn error of metabolism. So in the primary gout, increased level of uric acid is associated with increased synthesis of purine nucleotides. And this increased synthesis of purine nucleotide is caused by defective enzymes of the purine nucleotide biosynthetic pathway. So this is PRPP synthetase, PRPP glutamyl aminotransferase, and HGPRTase enzyme of salvage pathway. Then secondary gout can be the gout results from variety of diseases that cause an elevated destructions of cell which occur in cancers like leukemia or polycythemia, psoriasis and hypercatabolic state like in starvation and trauma. Then decreased elimination of uric acid which occurs in chronic renal diseases due to reduced glomerular filtrate rate, then glucose 6-phosphatase deficiency. Then what are the symptoms of gout? So gout, you can see there is an elevated concentration of uric acid in the blood and tissues. And there is a tendency of this uric acid to accumulate in the joints. The joints become inflamed, painful, and they become arthritic due to the abnormal deposition of sodium urate crystals. And patient with primary gout often show deposition of these urate in the form of tophi. You can see the swollen joints, the structure due to the clustering of urate crystal. That structure is known as tophi. So that happens in the soft tissues, tendons, and that affect the joints and leads to painful arthritis. The kidneys are also affected due to the excess urate also deposit in the kidneys tubules and leads to the renal failure. Gout can be treated by combination of nutritional therapy and drug therapy. Means dietary management or modification can also be done along with the drug therapy. So food especially rich in nucleotides, nucleic acids such as liver, coffee, tea, which contains a higher amount of purines like caffeine and theobromines are withheld from the diet. They should be restricted. And restriction of intake of alcohol is also advised because alcohol always increases, disturbs the NAD/NADH ratio, and there is increased concentration of NADH, which leads to the excessive synthesis of, affects the purine synthesis. Then use of drug that is allopurinol, which inhibits the xanthine oxidase activity competitively. So these are the line of treatment and management for the patient suffering from gout. Thank you.